Hello and welcome at the TV studio at the EACTS annual meeting, 30th annual meeting in Barcelona. I have with me here the Secretary General, Peter Capitan, to have a preview at this meeting this year. Hello, welcome.
Thank you very much.
So what are you looking forward to? What are the highlights of this meeting this year?
Yeah, so we have a couple of new things at the meeting, and that is one of them is the Jeopardy session, where teams are competing who has the best knowledge in cardiothoracic surgery. We actually also had it last year, but now we are expanding on it. So that will take place on Sunday and Monday. We have the rapid fire sessions again, where people have to deliver the lecture in 2 minutes, but then there are 6 minutes of discussion. So they stand in the middle and the audience is sitting around them. So it gives a completely different atmosphere compared to a normal lecture. And so we hope there for much interaction, so we all encourage the audience to ask questions and to discuss the issues that were presented. Then the other thing is what we have is on Tuesday evening, we have this 30th anniversary celebration. So that is, the theme is the 80s. So we hope that a lot of people will also dress up for that party. And the best costume will get a prize as well. So there's a very professional jury that will make the decision. But we're looking forward to that. It's Volkmar Falk from Berlin is playing with his band. And so there will be lots of music. There will also be dinner served. But yeah, we're looking forward to that as well.
That's great. Good to hear that. And are there many registrants this year?
Yeah, so now, yesterday we had already almost 4,200 registrations. And so normally during the meeting we expect about 500, 600 people to sign up. So that means that we will end roughly about the same or a little bit higher than last year, which was already a new record in Amsterdam. Mm-hmm. Okay. So it's going well.
Okay, yeah. Good to hear that. I saw in the program that there's also a lot of sessions on TAVI versus surgical AVR. Especially one session, if they are comparable in certain studies. Can you tell me something about that session? Yeah,
actually I think that's a great session that will take place tomorrow morning at 9:45 it will start. It's a session which is called David versus Goliath. The reason is that there were two surgeons that have written a letter to New England Journal of Medicine and The Lancet, and they were complaining about the study design of the partner trial. And especially the partner 3 data that was presented in the propensity match analysis. And so they argue that actually that analysis is not fair, especially not fair for surgery. So those arguments will be debated. And then finally, Nick Fremantle, who is a statistician from the British Medical Journal, will give his final verdict. He will say who was right or who was wrong. So we hope for a debate. It's more or less a little bit of pro-con session. And so we will see what comes out of that.
Okay, that's great. Looking forward to that.
Yeah.
And who's David and who's Goliath then?
Yeah, that's a good question. I thought about it as well. So maybe, well, the one who wins is David.
Okay.
If I remember very well from the Bible. And maybe so the surgeons are Davids.
Okay.
And yeah, TAVI might be the Goliath. Of course, we also have to face that there's progress in medicine. And I think TAVI is a great therapy for many, many patients. But the question, of course, if you go towards lower risk patients, whether that is still the truth, or whether then surgery might become better than TAVI, or whether they are comparable, and that one has an advantage for long term, the other has an advantage for short term. And I think that's what a little bit what the debate is about, I think.
Okay. Okay. Looking forward to it tomorrow morning. And then there's another big introduction this year. The MMCTS is going to be completely renewed.
Yeah.
Can you tell me something about that?
Yeah, so the last year we spent a lot of time for the multimedia manual for cardiothoracic surgery, which is the online textbook. In the old days it was a little bit more in the format of a journal. And people could not always find what they were looking for, especially the basic procedures were missing in the old MMCTS. So we're completely rebranding it. There will be a lot of display at the meeting about the new MMCTS. And then in November it will go live so that everybody can really access it online. So we hope that people will submit their cases to MMCTS, especially video is very, very important. As surgeons, we're used to look at something and to learn from looking and how other people do it, the procedure, and not so much about just reading text. So it will be a combination of text and videos, whereby I think the highlights should be the videos to explain you how to do a certain procedure.
Yeah. Okay. So the surgeon can actually go into the operating room with a camera, film it,
Yes.
And then not too much text around it, but just a
Exactly.
very practical explanation.
Yes, absolutely.
Okay.
Yes, and so the office of EACTS can also help with editing, give them advice how they should do it. And nowadays with new cameras, you can get much better quality than what we had in the past.
Yeah. Okay. Great to hear that. I'm looking forward to this meeting, and thank you very much for this interview.
Thank you very much.